Hi, my name is Dr. Tibor Lazar. I'm the owner and surgeon for Lazar Veterinary Surgery. I'm now going to talk about anal sacculectomy, a surgical procedure of the anal sacs in dogs and cats. To begin, though, I want to thank Webster Veterinary Supply for allowing me to use their DIA app illustrations. I think it's a great way to help show what the procedure is all about. So, talking first about anal sac disease, primarily in dogs, but we will see it in the occasional cat. The anal sacs are two structures on either side of the anus, so stool is about to pass out on this particular illustration. The pressure of the stool will express the anal sacs, and then this very foul-smelling substance will pass through the duct, mix in with the stool, creating a particular scent that's left with the stool. Otherwise, there's not a particular need to have the anal sacs. Most dogs, most owners don't even notice that the dogs have the anal sacs because it doesn't cause a problem. But in some dogs, especially a lot of the small breeds of dogs, we will get obstruction of the anal sac. There will be pain associated with this. Some dogs will scoot their back end on the ground, may try to lick frequently at the area. Some owners may actually realize some leakage from the anal sac. A dog may get up from the carpet or a couch blanket. They'll see a little wet spot, and if they smell it, it smells awful. And it's a bit dark colored as well. It can stain furniture and, again, wherever the dog is lying. In these situations, it becomes a clear problem. A lot of patients will go into their family veterinarian for frequent expressions of the anal sac, where by simply putting a finger in the anus, your veterinarian or one of the technicians is able to gently squeeze and express the anal sac. And it does provide relief, but it may only be a temporary occurrence. And it is not unusual to find that every month, every 2 months, at some regular basis, you have to bring your pet into the veterinarian to get the anal sacs expressed. So not a very pleasant experience. There is a certain amount of pain involved with the expression, not a tremendous amount, but enough that your pet is going to be learning very quickly what the visit to the vet means, which is a not very pleasant experience. So once this becomes a chronic problem, it becomes a fairly easy decision to recommend surgery as the best treatment. We can simply remove the anal sacs and be done with the problem. In certain situations, we'll actually notice that the duct, this little connection between the sac and the anus, becomes very thick, it becomes scarred down, and it becomes clear that the anal sac fluid is just not able to pass through the duct as it should. And in certain situations, the anal sac will continue to grow to the point that it actually ruptures, causing an abscess. And then again, these are situations where we know we have really no choice but to remove them. But even in just the typical scenario, which is a pet that has to have frequent anal sac expressions, it's a very underutilized surgery. It's one that owners are very happy once the surgery is done and wish that they had done it perhaps even years before. So let's talk about the technique. I'm going to draw a couple lines here. These red lines represent the surgical incisions. We basically make an incision over each anal sac, and then we gently peel away the anal sphincter muscle, which is attached to the anal sac, and remove the anal sacs. Not a very long procedure, and again, not very long incisions. Most pets are feeling quite good the day after surgery. As far as the short term, some swelling, bruising, some discharge is not terribly unusual. It is a dirty area, and so that is of some concern. I typically recommend after every bowel movement, getting a baby wipe and just gently wiping the area to hopefully reduce the chance for infection. But infection is certainly a concern given the proximity to the anus. Stool matter could very easily get to the incision and cause an infection. So we do send the pets home with antibiotics for at least the first week and potentially longer. Now, there are some potential major complications. As far as infection goes, we will sometimes see infection get deep into the incision, which could cause the incision to ulcerate, open up, and we may have to actually re-explore, look for any infected type of material, or in some cases, these pets may have had a previous anal sac rupture, and then we need to go find the remnants of the anal sac to clear up the problem. But typically it will clear up with a second surgery if it ever gets to that point. Infection can occur 2 to 3 weeks out, or in some cases it's several months following the surgery. Another serious complication, the one that owners should be most aware of, is the risk for incontinence. The anal sphincter muscle encircles the anus and it closes down to prevent the stool from passing out, so it is necessary for normal continence. I mentioned that we have to peel away this muscle from the anal sacs during the surgery, and so somewhere about 50% of dogs will have a temporary incontinence, a temporary damage to the anal sphincter muscle, where you may notice the occasional dropped stool in the house. Typically this is only an issue for 2 to 4 weeks from the time of surgery. I do recommend that you avoid treats, avoid change of diets, things that will cause a soft stool, because that would have a greater chance of passing through the anus area during this recovery period. There's about a 5% chance that the incontinence will be permanent, and that is a much more serious situation where a pet will very commonly have a dropped stool in the house, and that becomes difficult from the management side. There are some dogs, though, that will seem to have a permanent incontinence, and it will just take much longer, weeks to even months, to improve. So overall, while there are some potential risks of surgery, it's not something that we jump to surgery right away. But if your pet is having chronic problems with the anal sacs, overall the satisfaction, the pet's comfort level following surgery is very high, especially the fact that we don't have to pursue the anal sac expressions anymore.